create awareness back to back. Surrounding mental health, suicide prevention, healthy life in one way or the other. That's what the show is all about. Cannot also be reproduced into in one way or the other subsequently. It's good that it's Kunle Pelem0, they call me KP, and you know KP is in the building. I'm in the building today to have a kind of retrospect of the World Mental Health Day that happened on the 10th of October this year. It's a yearly thing, and somehow I wasn't able to come on Friday preceding that day, which I will have also created the content about that particular day on Friday preceding the show, like I said. But due to one reason or the other, circumstances beyond my control, I wasn't able to be on the show that day. But here I am today now, just to take this World Mental Health Day, and we want to observe and talk about some things. I'll also share some of the things I did, and then some of the necessary things that we should also do, learning from some events and places in all together on the show today. So that's what the show holds for you today. No doubt about it, it's going to be another blast for you. So if you have someone who is not listening, you just prompt that person, tell that person. That's how I always do. And I remember I keep telling you that you should as well. So that's it. World Mental Health Day in retrospect. That is what today's show is all about. That is what today's show is all about. So October 10th is World Every and the overall objective now, according to the World Health Organization, and I am reading verbatim, the world, and to mobilize efforts in support of mental health. That's what the day is all about. And it goes further to say the day provides an opportunity for all stakeholders working on mental health for people worldwide. So that is the purpose of that particular day. And this particular year, that's the World Mental Health Day this year, the theme is make it a reality. And I mean, that is explicit enough, stressing the fact that it should be something that cut across everybody. And in one of the articles, services for mental health, neurological, and substance use disorder to scale up quality mental health services at all levels. And some countries have found new ways of providing mental health care to their population. And in various countries, there are like the way that people can be reached at best, looking at the current realities of such countries. As we're trying as much as possible to raise awareness, find solution. We must also put into consideration the prevailing conditions in different environments. What will work better? That is not compromising quality. That's not compromising the message, but somehow the method might be a little bit different in order to really make sure that we are saying the same thing, we are doing the same, thing, but we might have to follow different routes for us to achieve whatever we want to achieve, for us to arrive at the same destination. So that's what that is stressing. And it's stressing the fact that it should be something that must be made available and affordable for all people. And there are several events that happen, during the course of that, commemoration of the World Mental Health Day. And I was part of some of them, and they've been wonderful. A couple of them, there was the African Mental Health Therapists and Influencers Conference that was tagged Mental Health in an Unequal World, that I was part of, and a couple of other speakers from, Africa. And it was just a wonderful time being there as well. And then there was also, because, like I read earlier on from World Health Organization, that some countries are trying to find a solution, based on their current realities. And there's a particular organization in my country of residence, which is Nigeria. And, they are trying as much as possible to see how to make mental health become accessible and affordable to people within that country. And that is very important, because some people see mental health as something that only speaks to the elite class, and that's why people don't really go to those remote areas somehow. If you go there to talk about mental health, it seems so strange to them, because they are aware had not really gotten there. And not only, generally, health is well in quote now, it might be expensive, but being expensive should not, number one, because just like they say that if you think education is expensive, try ignorance. So there is nothing, that should deter you or bar you from accessing a good mental health care, albeit there might be some issues of financial issues or the rest, because therapy sessions to some people, most especially in rural communities, and a way of at least helping those people at an affordable cost, in order to really make sure that there's a professional that reach and guide them in one way or the other. It might not be like the should be encouraged in different parts of the world, so that we can reach out to the remote areas, reach out to people in those places, and encourage them to speak up, and encourage them to make use of You're welcome back. What a great sound right there in the morning time, noon on the night.
We play the hottest hits. So hot, it melts your speakers.
Station on the Hill, MC Radio London.
Station on the Hill, MC Radio London. Station with distinction, and that's AP Radio UK. This is the MAASP show, reaching you live on those two stations. And you know what the MAASP show is all about. We're talking mental health and suicide prevention. And today we've been looking at World Mental Health Day in retrospect. What really, and I was sharing with you, from some of the places, or some of the events that went down that day that we can learn from generally. And the essence is that it's not enough. We can't say we've done enough and then we stop. We will retrogress. So that's why we need to constantly remind ourselves. I went to some places and some conversations sprang up, and I was saying, wow, these are some of the things that I've shared with people on the show, and some of the guests that also come to share with feeling right in me, if I must say it that way. It created a kind of feel-good factor in me. Let me say it again that way. So, because I felt, the conversation it's moving. To speak up, creating a safe space for people to speak up as well. And one of such events that I also attended was by Harmony Circle. Harmony Circle is an Indian-Nigerian collaboration to not only create suicide prevention, which has been attributed to mental health in those two countries, but even in other countries at large. So it was, I happen to be one of the founding members of that organization too. That's a collaboration between India and Nigeria. And if you look at those two countries, they belong to the low, mid, and middle income countries, and they share some similarities in terms of their, economy and, the realities of people who are living in such countries. Those who are, you have the far rich, and then you have the far poor people. And, somehow you find it so difficult to get the middle class because they've been compressed. So, there are diverse issues that are really affecting people's mental health in such areas. So we did make fit to create a conversation, and we spread our tentacles even across some other parts of the world, to places like Australia, where we have a guest or a panelist come to teach us or tell us the current realities in that place, in US, and then in India and Nigeria as well. And one of the things that was said that I really love from one of the guests, Pix Jonathan, who had also been a guest on this show a couple of months ago. We call her, couragepreneur. She speaks so well about courage and how to instill courage in people. And one question that was asked her that was, why do people take the ultimate step of suicide? When people had battled with mental health related issues and then they felt like the end has come for them, and then they would just go ahead and take their lives. And one thing he said is the fact that it takes even courage to do such. And I was like, wow, that's true, because it's not so easy for someone to just decide that he will just go and end his life. Somebody who has dreams, who has aspirations, desiretions, who has goals to achieve, who has vision. It takes courage to do that. But what he's saying is that we now need to start creating awareness and how to encourage people, how to help them now redirect that courage. Those people who are going through whatever they are going through, that will definitely now push them to take their lives. That courage now is used in the wrong way. So they use that courage to empower their problems. So why not redirect those people, help them in one way or the other, find, that courage or path away for that courage towards their vision, towards whatever they want to achieve in life, so that they would desist from that, act of taking their lives called suicide. I mean, that was so wonderful. And I really, really, resonate well with that. And also there were conversations around breaking silence and brick walls surrounding mental health. And at a point, we spoke about the myth around mental health right across every society. And I'm asking you, what are the myths about mental health that you know in your society? Remember, we've spoken about it on this show. For those who are, like followers of this particular show, we've spoken about it. The fact that people don't want to talk about it, they feel when you talk about it, you are increasing the risk and the reverse is the case. The more in that regard, or people feel there's just a class of people who have been affected by mental health related issues. It is said that 1 in 6 of us will experience mental health issues in any given week. And there is statistics that shows affect about 1 billion people all across the world. 1 billion people. That's, about like 1/6% of, people in the world. So you can see how enormous these discussions are. And that's why I keep saying that it's not enough, and we should keep discussing this particular issue every time, every now and then. And one question that was asked, one of the panelists was asked, at what stage do we need to take external help or support? And that is very, very important. At what stage do you need to take external help or support? So depending on what you do, because sometimes we have a whole lot of people who resort to bad coping mechanism. But you've been going through mental health issue, and then some people resort to alcoholism, some people resort to drug abuse, some people resort to self-harm, and while some people carry out some self-help practices. But at a point when you feel that what you're doing cannot really help you or cannot pull you out of this stuff, you need to now ask for external help. You need to seek help from professionals who will have more organized approach, more knowledge to help you in one way or the other and get you to that state, that is better than what only you can handle. So these are some of those things that were said that I felt I can also come to share with us right on the show. And one question was asked, and that's also what I'm going to ask now, that as a result of this pandemic, is suicide in your environment, in your country, is it rising? Is it on the increase? And one thing also the issue of the vaccine, different theories. Some people are for, some people are against. And all these things are creating emotional distress in people, psychological distress. Some people are on the fence. They don't even know which is which, what to do, where to go, where is a safe haven for them. So all these things, there are some people who are pushed to the wall and they have gotten to a place called the breaking point and they will want to give in to their problem. So what is the situation in your area? But like I said, we might not particularly attribute whatever stats we are seeing to the pandemic, but it might just be a case of correlation. You know, a whole lot of factors might be responsible. But when we speak about statistics, and I've said it on this show before, it is not the number now that should, because what we're talking about is the life of the people. It's not the number that should only the number right now. Yeah, it's good to bring down the numbers. The same way, we need to also know that it should be one death too many when we're talking about issues like suicide now. So it's not whether it is 10,000 people or 12,000 people who are dying, but if one person dies, this is not what we want, because it's a life. Statistics of human beings are not just, abstract values, abstract things that we can't see. They're human beings, human lives. And if you value lives, that means we must work towards protecting it and then preventing whatever can lead people, towards taking their lives. So that is very, very important. And all these things, there is also the collective responsibility of the government, and every other stakeholder in the industry to come and, in one way or the other, make a statement. And the last but not the least thing that I will share is the fact that we spoke about how social media, should, there must be a personal responsibility of regulating your screen hours. It is said that between 8 to 10 people take about 10 hours every day on, the app screen hours. Either you're watching TV or your phone. And then older people take about 11 hours. So you look at that. It was even said that some people, spend more times on their phone. That's inside now. I mean, more than prisoners do, So it is like a world that people are being engaged in one way or the other as a result of, their interaction with social media, with other screen devices, taking their time. And there are so many other things that are associated with that: fear of missing out, perceived social isolation, that kind of feeling that some people are benefiting from something and then you are losing out. So you want to join them, you want to flow, you want to get in the flow. That's how they say it in one way or the other. So all these things are things we can put together to help ourselves grow up mentally and stay mentally healthy. If you see the way I am, I've been talking at the later part, that I'm almost out of time. So that is just the retro I came with for us on the show as regards the World Mental Health Day on 10th October 2020 show today, and I hope in one way or the other you've learned something. And like I said, you should be an ambassador of mental health in your immediate environment. Special thanks to my producers, Mr. Sojiamini and O Fields on MZ Radio London and AP Radio UK, respectively. The next week that I'm going to see you, like I do say, stay mentally healthy. Bye for now.